Good day, dear guys. Topic of our lecture today: carcinogenic factors in the oral cavity, ways to identify and eliminate them, the role of oral microflora and protection factors in the development of caries and periodontal diseases. So, caries is a pathological process starting after the tooth eruption. It is characterized by demineralization and destruction of the hard tissues, followed by formation of a defect, so caries cavity. According to the World Health Organization recommendations, there are three basic indications for assessment of the affection with dental caries. So it is prevalence, intensity, and growth of its intensity. Caries prevalence is the ratio of population with teeth affected with caries, so delay, filled, and missed, to the total number of examined people. World Health Organization recommends to assess the caries prevalence in 12 years old children as follows: from 0 to 30% low, 31 80% it is medium, and 81 to 100% it is high. Intensity of dental caries index is the number of decayed, filled, and missed teeth per person. Caries index for children with deciduous dentition is registered as DF. It is little letters DF. Decayed and filled, as missed deciduous teeth do not come into account. So caries index for children with mixed deciduous and permanent teeth is marked as DFM, big letters, plus DF, small letters. And the intensity in 12 years children as a basis for the assessment of state of hard dental tissues. So caries intensity growth index is used for assessment of caries progress and its prevention. So you should know about 400 theories of caries origin have been suggested from the beginning of development of stomatology. The most known of them are the following: Miller's chemical and parasitogenic theory, and it's a theory of antins, and Lukomsky theory. So by present time, it has been proved that development of dental caries is associated with the caries with the oral microflora, with the leading role of Streptococcus and Streptococcus mutans above all. Etiological role of microorganisms in the development of dental caries has been proved by experiments of sterile animals. So there are three stages of formation of dental plaque, and carcinogenic factors can be local and general. To local, you should know about plaque, microbial insemination in the oral cavity, violation of the composition and properties of saliva, early teething and eating soft food, composition and properties of tooth enamel, excessive consumption of sweets, and violation of local immunity. In general, it is unfavorable course of pregnancy. It is somatic diseases of the child, malnutrition, hypovitaminosis, and violation of general immunity, low fluoride content in drinking water, unfavorable ecological situation, and hereditary and genetic factors. So, carcinogenic factors can be of different intensity and character. So, there are different variants contribute of the emergence of the carcinogenic situation is created when any carcinogenic factors or a group of them acting of the tools makes it susceptible of the effects of acids and mm, of course, you should know about three stages of formation of dental plaque. For first stage, it is organic film, so it is pellicles. Second is microorganism and epithelial cells. Is adsorb of the pellicular surface. And three, it is formation of major dental plaque. And you should know about that dental plaque consists of microorganisms up to 70% and intercellular matrix, so it is complex of glycom saminoglycans and proteins, and dental plaque is the most people contain basic types of microorganisms in varying proportion. So, with good washing of teeth with oral fluid, the local pH is quickly leveled. However, in areas of poor saliva access, the demineralization process may prevail over the remineralization process, and the caries process progress if the rate of salivation decreases, the amount of saliva decreases, its viscosity increases. The pH indicator is of great importance in the progression of the caries process, and the concentration of hydrogen ions in the oral cavity affects the activity of saliva enzymes, the processes of mineralization and remineralization of enamel, the activity of microflora, and studies have shown that at a pH below 6.2, saliva from oversaturated with hydroxyapatite becomes becomes undersaturated, and therefore it turns from a mineralizing liquid to a demineralizing liquid. So, factors affecting the development of caries. Of course, it is various types of violation of the structure of the teeth that have arisen during embryogenesis and antifacial feeding, severe debilitation, diseases in the first months after birth, prematurity of children, antibiotic therapy in the first months after birth, and insufficient fluoride intake into the body. So, factors from 3 to 7 years old, along with above other factors join. So it is genetic predispositions, it is elementary factors with when carbohydrate food predominated in the diet, and protein and micro elements are not enough, in insufficient dental function leading to poor chewing of food, and of course poor oral hygiene alone plaque to accumulate of the teeth composed of microorganisms, anomalies and deformation of a bite, and insufficient functional activity of the salivary glands. At a later date, about common risk factors for caries, it is inadequate oral hygiene, fluoride deficiency, in drinking water and food, and balanced diet, hereditary predisposition, and decrease in the body's defenses mechanisms, both at local and general levels. Of course, of the system level, resistance of carriers depends of facial skeleton, building type, jaws, occlusion, yes, and factors in the oral cavity. It is abundant dental plaque, insufficient mineralization of enamel in the fissure and cervical and proximal areas. It is reduced resistance of tooth enamel, reduction of salivation, and a reduced mineralizing potential of the oral fluid, so pH buffer, capacity, and the content of calcium. Eating soft and sticky foods, eating foods with predominance of carbohydrates, densely spaced teeth, and decrease in non-specific defense factors. Abundant dental plaque, so it is revealing hygienic indexes and elimination. First, it is control of food intake and throughout the regular oral hygiene. And saliva has the following mechanisms providing carriers resistance of dental hard tissues. It is mechanic-clinic, antibacterial influence, saliva buffer, and mineralization function. So insufficient mineralization of enamel in the fissure and cervical and proximal areas. So it is reveal and instrumental with sound and lack of density. Visually, electrodontodiagnostics, eliminations of fissure sealing at optimal time after teasing. Remember that after teasing we have only 2 years for fissure sealing. Then local remineralizing therapies. It can be application with remineralizing solutions, coating with fluoride varnish, and fissure sealing is performed on the choven surface of premolars and molars. Any filling materials can be used as sealants, but composite is better, of course, and fissure sealing is effective for from 1 to 2 years. It is case to start of treatment and after treatment. Reduce resistance of tooth enamel. Please using the test of enamel resistance test. You will have some questions in your tests. It is etching of enamel followed by the application of the crusty substance. It is a local remineralizing therapy, and on the teeth we have painted our teeth, and after we should know about points of test of enamel resistance of the shape of color. And mouthwash with solutions with mineral components, and electrophoresis of calcium and fluoride preparations. So reduction of salivation and reduced mineralizing potential of the oral fluid, it is pH, and buffer capacity and the content of calcium, phosphorus, and fluoride in it. So revealing a study of the rate of salivation, study of biochemical and biophysical parameters, and elimination of factors contributing to a decrease in the function of the salivary glands. Mouthwash, toothpaste with polymeral complexes, and adhesions used to calcium, phosphorus, and fluoride preparation. And please look on this picture. It is case with big amount of subgingival and supragingival calculus. So, and balanced diet, eating soft and sticky foods, yes, revealing and eating foods with a predominance of carbohydrates, though the most carcinogenic action is possessed by easily digestible carbohydrates, and the carcinogenic effects of carbohydrates is due to the fact that for metabolism of simple carbohydrates, in contrast of other nutrients, so proteins, fats, complex of carbohydrates, in the human oral cavity, there are all the necessary conditions, a full set of enzymes of microbial origin necessarily for glycolytic pathway of digestions of carbohydrates and constant temperature. And densely spaced teeth. Please look during dental examinations and orthodontic treatment. And natural defense mechanism oral cavity, the study of immunological perimeters of the oral cavity, so such enzymes such as lysozyme, immunoglobulins, and eliminations, prescription of funds that stimulate natural defenses mechanisms. Oral microflora. Very interesting information. The species composition of microflora is diverse and includes representative of all groups of microorganisms. It is bacteria, actinomycetes, and the spirochetes, rickettsia, and viruses. So oral microflora, the biggest group, it is cocci from 80 to 90%, and they have high activity. They break down proteins with the formation of hydrogen as sulfide and break down carbohydrates. So streptococci are the main inhabitants. In 1 millimeter of saliva, they are from 108 to 1010. So it ferments carbohydrates by the type of lactic acids fermentation with the formation of milk. And streptococci refers to conditionally pathogenic flora and due to the formation of lactic acid. So consumption of easily assimilated refined carbohydrates is one of the most important and broad pathogenic factors of dental caries. And the main carcinogenic role of these products lies in their ability for metabolism in oral cavity with intensive excretion of the oral acids. Taking with consumption of easily assimilated refined carbohydrates, two processes take place. Their rapid metabolism with formation of organic acids with prevalence of lactic acid. So there is a combination form a carbohydrate depot saved by microflora for future support of its vital function between food intakes. And caries resistance of teeth is ensured of the following. So correct formation of the dental germ and correct dental development, then full and timely enamel maturing after tooth eruption, optimal chemical content and structure of tooth enamel and other dental tissues, optimal chemical content of saliva and mineralizing activity, then sufficient quantity of oral fluid, low level of permeability of dental enamel, then sufficient Chevron load and self-cleaning of dental surface, and careful oral cavity hygiene, well-balanced diet, specific and non-specific factors of oral cavity protection, optimal fluoride content in drinking water. Then of course, the role of microflora, it is currently, there are more than 400 different theories, yes, and some theories I write in this slide. Please note in your synopsis. So, Miller's, it is chemical and parasitogenic theory, and it is physical-chemical theory. Lakomsky trophic theory. Then Merton's theory of proteolysis and chelation, and Rybakov concept of opposite effects of the dental pulp. However, none of these theories gives the full answers to number of questions related to etiology and pathogenesis of dental caries. So the immediate cause of caries demineralization is microorganisms. Microorganisms that release organic acids as a result of their enzymatic activity. And a role of microflora in the development of caries. The carcinogenic effects of microorganisms is associated with the formation of dental plaque. So dental plaque consists of microorganisms, yes, up to 70%. And dental plaque is most people contained basis type of microorganisms in varying proportion. Streptococcus, mutans, salivarius, metis, and amount is above 40% of all plaque microorganisms. Streptococcus mutans is the most carcinogenic microorganism. It produced lactic acid out of glucose and it formed glycane out the sucrose. Carbohydrate food is substrate of rapid metabolism for microflora of dental plaque, mainly by using glycolysis with production of organic acids. And further formation of organic acids of the enamel surface leads to further demineralization and gradual extension of microactivity between the crystals and enamel prisms. And dental resistance. Dental resistance is continued by the large number of factors from molecular to population, including genetic predisposition to caries, and one of the molecular level dental resistance depends of enamel hydroxyapatite type. So on the level of dental enamel, the resistance against Influence of acid factors depends on the enamel structure, presence and number of defects in it, formation of enamel fibers and their bundles, and electric charge of the enamel surface, and can prevent or promote absorption of microflora on it. And on the organ level of a tooth, caries resistance depends of topography of enamel surface, depth and form of fissure, and natural excavation of dental crowns. On the system level, dental velar system resistance to caries depends of facial skeleton building type, jaws, occlusion, tightness of teeth, sizes of interdental spaces. And on the organism's level, resistance of caries depends of functioning of salivary glands and salivary washing and cleaning of dental surfaces. So enamel structure of the deciduous and permanent teeth is determined by genetic factors, and it's largely depends on completeness of mineralization. So next one, oral protection factors. Oral cavity defense mechanisms are present in two groups. It is non-specific protective factors act on all types of microorganisms, and specific act only on certain types of microorganisms. It is believed that mucous membranes included in the oral cavity have their own immune system and do not depend of general immunity, so immune complexes. And oral protection factors, non-specific protection factors, it is mechanical, so washing off by microorganisms with saliva and cleansing the mucous membrane during meals, and adhesion of the epithelium. Biological, due to the action of some biologically active substances in the oral fluid, then lanzones and in the alkaline protein that acts as a mucolytic enzyme. The protective active consists in the lysine effect on the membrane of main microorganisms, usually gram plus, and stimulation of phagocytic activity of leukocytes, participation of regenerative processes. And specific proteins protection factors, it is specific immunity, it is the ability of the microorganisms to respond to antigens that have entered it. The main factor of specific antimicrobial protection is immunoglobulins. There are 6 classes of immunoglobulins. It is A, G, M, E, D, and U. Only 3 are represented in the oral cavity. So it is A, G, and M. And immunoglobulins class A, they are presented in the 2 varieties, serum and secretory. And synthesized immunoglobulin A in the cells of the mucous layer and salivary glands, and immunoglobulins A in plasma cells in epithelial cells. So immunoglobulins protected the internal environment of the body and including in the oral cavity from various agents. Dear guys, thank you for your attention, and I wait for your synopsis. Please look for a time and submit your synopsis in time. Have a nice day. Goodbye.